Hello everyone, I am Dr. Anupama Chowdhry Devgan, your Physiology faculty, and this is the daily quiz series in the run-up to NEETPG 2025. We are in week 5, day 3, and I will be taking up questions on endocrinology and environmental physiology. So let's have a look at the first question. It says, a patient with type 2 diabetes mellitus has been advised regular exercise and physical activity to improve his insulin resistance. Which of the following glucose transporters will show an increase in the target organs with exercise? So basically the question is asking you which is the insulin-dependent GLUT. The insulin-dependent GLUT is GLUT4. Regular exercise will increase GLUT4 in the target organs. And which are the target organs we are looking at? These are basically the muscles. Of course, the target organ for insulin are not just the muscles, but also the adipocytes and even to some extent in the liver. So the answer to this question is D, GLUT4. Identify the hormones A and B responsible for negative feedback on the hypothalamus-pituitary axis. So GnRH from the hypothalamus acts on the anterior pituitary. There is increased secretion of LH and FSH. The FSH receptors are on the Sertoli cells. S in FSH, S Sertoli. And the LH receptors are on the Leydig cells. L for LH, L for Leydig. Now, Sertoli cells will secrete a hormone which is known as inhibin, and this inhibin has a negative feedback effect on the secretion of FSH. Leydig cells will secrete testosterone, which is responsible for androgenic and anabolic effects, and this has a negative feedback effect on not only the secretion of LH but also on GnRH. So the question says identify A and B. So A is inhibin and B is testosterone. So the answer here becomes inhibin and testosterone. Let's look at the next question. In which of the following conditions is cortisol the highest? In Addison's disease, we expect cortisol levels to be low. A normal person after giving dexamethasone, by negative feedback, decreased ACTH and decreased cortisol. A normal person after waking in the morning definitely has very high cortisol levels, but let's look at the fourth option. This is Sheehan syndrome or hypopituitarism. Hypopituitarism, and there is decreased ACTH and therefore decreased cortisol. So my best answer here is normal person after waking up in the morning. Just a brief mention about what happens to different hormones during sleep. Now, in the first half of sleep, there is an increase in growth hormone. This peaks at around 11 p.m. And there is also increase in prolactin. Prolactin levels follow growth hormone. So the peak of prolactin is slightly after the peak of growth hormone. So these two hormones rise in the first half of sleep. In the second half of sleep, cortisol, which is now begins to rise. This is cortisol. So maximum cortisol will be in the early hours of morning, and thereafter there is a decrease in the cortisol level. So first half of sleep, growth hormone and prolactin. And in the second half of sleep, there is an increase in cortisol, which peaks in the early hours of morning. Serum prolactin levels are high in which of the following? Now, the prolactin is controlled by prolactin inhibiting factor from the hypothalamus, which is nothing but dopamine. And prolactin inhibiting factor inhibits the secretion of prolactin. So prolactin levels normally are very, very low because the prolactin is being inhibited by the release of prolactin inhibiting factor from the hypothalamus. But there are certain conditions where there is going to be an increase in prolactin and there is a little mnemonic for this. New Pets Shop. New is nursing. P is pregnancy. Very importantly, the prolactin levels will rise during pregnancy. They peak at the time of delivery. Very high prolactin. But as soon as delivery happens, the prolactin levels start falling and they reach pre-pregnant levels by the 8th day. But every time the mother nurses the baby, there is an increase in prolactin. Please understand, in the intervals between nursing, very low prolactin. Every time the mother feeds the baby, there is a sharp increase in prolactin. E is estrogen. T is TRH. When does TRH increase? Hypothyroidism. So many times, it will happen that a hypothyroid patient presents with galactorrhea, milk secretion from the breast. Because in hypothyroidism, increase in TRH, and which in turn increases prolactin. S, sleep, NREM sleep, stages 3 and 4. Stress, strenuous exercise, sexual intercourse, breast stimulation. H stands for hypothyroidism. I've just explained it to you. O is opiates and P is phenothiazines. So these are the conditions which will increase prolactin. So these are the conditions which will increase the prolactin levels. Now let's look at the options. Do I expect prolactin to increase in REM sleep? No. Prolactin levels will increase in NREM sleep, stages 3 and 4. 1 week after delivery? No. I've just told you that the prolactin levels peak at the time of delivery, but after delivery, there is a sharp fall in prolactin, and by the 8th day, prolactin levels are the same as non-pregnant levels. 1 hour after running, during a strenuous exercise, yes, there is increase in prolactin, but after 1 hour after running, we expect the prolactin levels to fall. So my answer becomes when estrogens are high. I've just told you estrogen, New Pets Shop, the E stands for estrogen. During high-speed aerial maneuvers, a fighter pilot experiences both positive and negative G forces. During rapid ascent with positive G, he experiences tunnel vision and almost blacks out. Which of the following is the most likely cause of the pilot's experience during positive G? So, positive G and negative G forces. These normal people, most of us will never experience these. Yes, of course, they do say that when you're in a very high speed lift, you do experience some of this positive and negative G forces, but really not all of us, most of us are not going to experience these forces. But our fighter pilots, Indian Air Force pilots and astronauts are subjected to positive and negative G forces. Now, during a rapid ascent, there is a positive G force. The normal gravitational force which is acting on all of us on the Earth's surface is 1G. Positive G means when the gravitational force becomes more than 1G. Now, because of a positive G forces, there is going to be increased peripheral pooling of blood. This now decreases the venous return, decreases the cardiac output, and this can give rise to a condition which is known as blackout. Reduced cardiac output means reduced cerebral blood flow, and the patient can lose consciousness, or the fighter pilot in this case can lose consciousness. So blackout is a possibility because of positive G forces. Now, there is also something known as negative G. Our fighter pilots, astronauts are also can experience negative G-force. Now, what happens in a negative G-force is when the gravitational pull or gravitational force is less than 1g. Now, there is an increased flow of blood towards the head end of the body. This will increase the cerebral blood flow. There is also a conjunctival and scleral congestion. And this condition is therefore known as a red out, because when you look at the eyes, they are congested. The sclera is congested. So this gives rise to what is known as a red out. Of course, because of the increased cerebral blood flow, if more blood is flowing towards the head end, it can cause a rupture of the cerebral blood vessels. But usually that does not happen. It may happen, but usually it does not happen because there is a protective mechanism. Along with increase in blood flow towards the brain, towards the cerebral blood vessels, there is also increase in flow of the spinal fluid towards the head end, towards the brain. So this kind of protects the cerebral blood vessels against a rupture. So the answer to this is positive G increases peripheral pooling of blood. Negative G will increase the cerebral blood flow, and positive G decreases venous return. Positive G does not affect the baroreceptor sensitivity, so that is not the answer. Answer is B.